Incorporated on 106.5 FM KRJB, Gold 101.5 KRJM, RJBroadcasting.com, and via live video web stream from yourliveevent.com, which is powered by R&J Broadcasting Incorporated and Halstead Telephone Company.
R&J Broadcasting Incorporated at 106.5 KRJB, Gold 101.5 KRJM. I am Mark Askelson, and you're listening to the COVID-19 call-in show. We're also live on yourliveevent.com via YouTube and all over the world. Joining me here today on our COVID-19 call-in show, first ever and hopefully last ever. Who knows if we have to keep doing this, but as the pandemic continues, we'll be joined briefly here by Dr. Rich Vetter, Chief Medical Officer of Essentia Health. And also in studio here with us, we have Aaron Stoltman, Administrator of Essentia Health in Ada, and also Sarah Kjono, Director of Norman Mahnomen Public Health. Good afternoon. How are we doing today?
Good afternoon. Doing well.
Doing well. Thank you.
Awesome. Well, it's been a crazy couple weeks, since things have, since this pandemic has kind of reached our state and now even locally. So, what changes now? Anything change here as we've kind of hit it in Mahnomen County anyways? Anything change here, Sarah?
No, I think like I said before, we've been anticipating that first case to pop up, and we really should have been working under the assumption that it was already here. And so we're just continuing with the, stay at home when you can, social distancing, wash your hands, cover your cough, all of those things we've really been talking about for the last couple of weeks. So continue to do those things and help to keep everyone safe.
And how about you, Aaron, at Essentia Health in Ada? Do you guys kind of maybe start, I'm sure you've made lots of preparations, and so do you kind of start now start reviewing those even more and be ready for that kind of first case, or?
Absolutely. Like you said, we've been preparing for a number of weeks, and now having a case so close to us to the east with Mahnomen County and to the south with Clay County, it just kind of brings it home a little bit more so.
Gotcha. All right. And so now, again, this is a call-in show, so if people do have questions, we ask them to call us at 784-2844. We've had a bunch emailed. We'll get to those momentarily. You can still do that. Email us, krjb8@loretel.net. Also on the YouTube stream on yourliveevent.com. We do have comments available. People can comment on that and question or ask questions on the YouTube link as well. We're going to go now to Dr. Rich Vetter, Essentia Health, Chief Medical Officer, joining us here on the phone here this afternoon. Dr. Vetter, thank you so much for joining us.
Thank you so much for having us and letting us help get the message out.
All right, what's the last few weeks or maybe month or so? What's that been like for you in the medical profession, preparing and getting ready for this? I mean, what's it been like for you?
Well, it's as Aaron said, it's been a very busy time planning. I think we've had the luxury of being in the upper Midwest, where we've had a little bit more time than maybe the coastal regions of our country have had. So we've been trying to take advantage of that time and preparing ourselves and our facilities as best we can.
Gotcha. All right. Well, we got a few questions kind of specifically directed towards the medical field. You might be best off answering. I've heard a lot of discussions around Tylenol and Advil, if you get it, or ibuprofen, how that can affect the fever. And I don't know if it's misinformation. I haven't heard any factual information on it. Do you know anything as far as if you get COVID-19, do Advil or ibuprofen or Tylenol have a positive or negative effect on it?
Yeah, I would say it's probably too early to tell. There are some case-by-case reports of people maybe doing a little bit worse when they've had a serious case of COVID infection when they were taking ibuprofen. But again, that's just some case-by-case reports. It's hard to say if you look at it as a population whether or not that has an effect. We do know that Tylenol is safe. If you go back and look at influenza back in the 1960s with aspirin, some of you might remember Reye's syndrome was associated with influenza and aspirin. And so I think that's probably the other historical component that has people concerned about a potential risk there as well, because aspirin and ibuprofen are kind of similar. They're in that same chemical class called non-steroidal anti-inflammatory drugs. But at this point, I would say that there isn't any really conclusive evidence to say that ibuprofen is worse than Tylenol.
What medications are you prescribing or are doctors prescribing for patients of COVID-19? Is there any prescriptions that you guys are writing out?
So as you know, COVID is a viral illness. There typically aren't a lot of treatments for viral illnesses, although in the last couple of years there's more antiviral agents that have come out, for example, for influenza, cold sores, and so on. So we do have some antiviral drugs out there now. There has not been any conclusive studies on any treatment in COVID infection, just because, as you know, it's relatively new. There are studies underway across the nation to look at the efficacy of various treatments. Been hearing a lot about hydroxychloroquine or chloroquine, an antimalarial drug, an anti-inflammatory drug that's used for lupus and rheumatologic type conditions and malaria, as having some antiviral properties. And that's been studied in the past in that regard as well. It's been around for a long time, so we have a pretty good idea of its risk-benefit profile. But again, I would say outside of a study, I would really just talk and treat those on an individual basis. We are preparing for inpatients to have that drug available for people that might be, more seriously affected. Given that there aren't any other known treatments other than just supportive care, that in conversation with the patient and family, that would be something we would be able to offer.
Dr. Vetter, can you get the COVID-19 virus? Can you get that twice? That was a question here from one of our listeners here this morning. Can you get COVID-19 twice?
Well, again, I think it's too early to tell. We know that COVID-19 is a subset of a larger group of viruses called coronaviruses, which have been known to cause like the common cold, for example. This is just a novel virus, meaning it changed its function and its genetic makeup, and that's why there's not much immunity in our communities regarding that, because it's a new virus that we're being exposed to. Over time, the hope would be that we would develop immunity to that, or at least partial immunity. But whether or not the virus will change itself again, I think remains to be seen. The initial studies that I've heard say that it does look to be relatively stable, so they don't think it'll be changing real rapidly. But just like influenza or other viruses, every several years they will change or adjust a little bit, and we have to continue to modify our vaccines to keep up with those changes.
And another question here that we had from a listener this morning. As far you mentioned immunity, can you build up a natural immunity? Does that help with COVID-19? Doing things to help build up your natural immunity, and what things can you do to help build up your immunity?
Well, I think the key things are just those healthy lifestyles that we all know we should do, but we don't always do them. And that's eating right, exercising, getting enough sleep, hand washing. Of course, we've heard a lot about. Managing stress. All those things have been shown to reduce or improve our function of our immune system. I think the other two things I would mention is smoking, as well as excessive alcohol use can also suppress your immune system. So again, it's just those healthy, common sense lifestyle things that will help. If you do take an immune suppressant drug for some other underlying medical condition, I would not recommend at this point that you stop that. I would want you to talk with your healthcare professional before you would do that. I have been getting a few questions about that. Should I stop these drugs in advance of potentially catching that COVID-19 infection? And again, the recommendation at this point would be to not stop, but to talk to your healthcare professional first.
And now, have you yourself personally treated anyone with COVID-19 or been in contact or worked with patients that have had COVID-19, Dr. Vetter?
No, not to my knowledge. Of course, there's probably asymptomatic people in our community that might be carrying or have been infected with the virus that we just don't know about, but their symptoms are so mild that we don't consider that diagnosis. We do know, and I just want to reassure your listeners that over 80% of people that get COVID-19 are going to get mild symptoms or symptoms that they can certainly treat at home. It's only a small subset of those higher risk patients that are going to get more acutely ill. And so again, the majority of people that will catch it will have a more minor type symptoms or no symptoms at all. Current estimates are that as many as 20% of infected patients might actually be asymptomatic or have no symptoms at all.
That brings up another question here. What are the big difference between the mild symptoms and the more severe, symptoms where it's going to require hospitalization and things like that? What does that look like What are the big difference between the two where you want people in the hospital being treated?
Yeah, so the main one is going to be increasing respiratory distress. We know that this virus causes a type of viral pneumonia or lower respiratory tract type of pneumonia, and your lungs then can kind of overreact or get what they call ARDS, which is acute respiratory syndrome, which might require additional oxygen and or even mechanical ventilation at some point if it gets severely worse. So the main thing to watch for, I would say, would be persistent or ongoing high fevers, or particularly shortness of breath would be an indicator to seek out medical care.
All right. Again, chatting with Dr. Rich Vetter here, Essentia Health in Ada, Chief Medical Officer. And Dr. Vetter, lastly, what procedures do you have in place? Say you have someone coming into the hospital with COVID-19. I mean, do you lock down certain parts of the hospital? I mean, I don't know how intense it is actually at the hospital itself. I mean, what procedures do you kind of put in place to protect everyone else at the hospital when you do have a patient in the hospital with the coronavirus?
Yeah, so the one thing we did a couple weeks ago actually is we started restricting access to our facilities, so only having certain access points. We've been doing screening of all visitors, as well as limiting the amount of visitors to our facilities, including our facility in Ada. We've been asking our staff to self-monitor and self-screen themselves, meaning to take their temperature at home. If they have a temperature, they're not to report to work, or if they don't feel well or feel like they're having some sort of respiratory symptoms, they've been asked not to report to work. We're spending a little bit more time with hand sanitizing and having those available for our visitors, as well as cleaning down surfaces, hard surfaces, and other surfaces to keep our environment as clean as possible. And then we've also been asking our staff to practice the social distancing that we're all hearing about, to not congregate in small areas. We have a lot of our employees right now that can work from at home, are working from at home as well.
Awesome. All right. Well, anything else that you want to share with our listeners here today, Dr. Vetter?
I think the main thing would be to really just thank our communities for the way they've responded. The idea behind the public health measure of staying apart from each other is to reduce that spread, decrease the burden on our healthcare facilities so we don't overwhelm them. So when and if that care is needed, we have the resources there to care for you. I think, again, our communities have responded amazing, and just to ask them to continue to heed the advice of the public health officials, and hopefully we can all make it through this.
Awesome. Well, I appreciate you taking some time to join us here today and all the work you guys are doing there. Thank you so much for joining us.
Oh, my pleasure. Thanks again for having me.
All right, Dr. Rich Vetter with Essentia Health, the Chief Medical Officer, joining us here on our COVID-19 call-in show. And, of course, we are open. Our phone lines are open. If people do have questions, they can give us a call here at any time now, 218-784-2844. 784-2844. Don't worry, we won't share your name or location if you don't want it out there. But we'd love to field questions here as we have in studio again Aaron Stoltman, the Administrator of Essentia Health in Ada, and also Sarah Kjono, Director of Public Health. What are the, I guess my question for you, Sarah, with public health, are you guys ready here in Norman County as well, kind of for, the Mahnomen County's got it. Are you expecting to see it here in Norman County very shortly, or at least confirmed cases?
I think so. I mean, we are assuming, like I said, it's already here, and so we know there's been some issues or maybe availability of testing with supplies, and so I really believe that if we could have been able to do more testing, we probably would already have a confirmed case. We've been following the Department of Health Lab has only been able to test and prioritize, those hospital patients, those symptomatic healthcare workers, and then those in congregate care settings. Now, we have seen some increase in testing through some private labs, and so that is encouraging, and so that's opening up the availability and being able to get more people tested. So I think as that happens, we're probably going to see some more confirmed cases in all areas of the state, and we do believe there will eventually be cases in every county, and I think that was pretty clear from the governor and from Commissioner Malcolm in the last few days as well.
Say someone local here wants to get tested. Maybe they've been in contact with someone that they knew has it or may have it. How does someone get tested? Can they get tested?
Yeah, so what we're encouraging people to do, and we're getting that question quite a bit, especially with having some more local cases, we really are encouraging people to call their healthcare provider. Think about where they've been and if they've actually had an exposure or if they're symptomatic. We're not going to be testing people who are not having any type of symptoms. And so people really need to call their healthcare provider. You can do a virtual or an online visit a lot of times, and a provider is going to kind of go through a screening questions with you and determine if you would even be a candidate or or need testing, because we know not everybody needs to be tested, right? And like we said, 80% of people are going to have those more mild symptoms, and that they can care for at home, and we want them staying home and taking care of themselves just like they would during influenza or any other type of cold or sinus infection or whatever you can just do to stay home and take care of yourself. So I think that's the important thing for people to know, is that not everyone needs to get tested. We need to just assume that that's probably what we have, and to try to practice the social distancing, stay at home, isolate yourself in your home so you're protecting others around you to help to slow that spread. And so there will be a certain population of people who will get tested, maybe if they've had a direct exposure to a confirmed case, or if they have an underlying health condition, or, there's a variety of reasons, but it's really a decision for you and your healthcare provider to discuss.
All right. Now at Essentia Health, I know she touched on like virtual visits. Aaron, you guys are now offering virtual visits and things like that, or e-visits, or people can do this from their home, right? Kind of talk to me about that opportunity that you guys have at Essentia Health.
Absolutely. So the e-visits are offered for folks who are experiencing symptoms or feel they may have been exposed to COVID in some way. So that's really the avenue that we're offering those folks, as the e-visits. Virtual visits is something a little bit different. So we stopped our routine visits, right, our well care in person in the clinic, and the virtual visits are really meant to take care of people who maybe have chronic diseases like diabetes or hypertension or those types of things where they need that routine follow-up. They need to visit with their healthcare provider. And so virtual visits are available to those folks. And when you call the clinic, you can have that conversation and decide if a virtual visit is appropriate. We can set you up with that. We are doing some, but minimal, in-person visits still for those folks that need that type of care as well. But really for folks who are experiencing symptoms, upper respiratory symptoms, symptoms related to COVID, or think they've been exposed, we are really asking them to start with the e-visits.
All right. And Sarah, have you been fielding a lot of calls now since, I guess, in Mahnomen County, now that with the confirmed case, people concerned that, they may be in touch with this individual, our employers may be concerned now, have you been fielding questions or calls kind of about how to go about, now that it is locally?
Yeah, so we really anticipated kind of the community's heightened sense of, awareness, or maybe people who were thinking, oh, well, this isn't going to happen here, because we think we're a little more rural and things don't come here at least as quickly as other parts or the metro region. But definitely, yes, since it was released that we had a confirmed case, we've definitely had more questions. We're very fortunate over in Mahnomen County that we partner with White Earth. And so they have an emergency operations center functioning out of the casino there. And so they are able to have a one-call center over there. And I know their one-call center has been getting more calls. And that's really the purpose of that, is to help field those community questions, because we don't want to overrun our local health systems either. I know after the confirmed case came out, a lot of people were calling Mahnomen Health Center and really wondering about testing and just, I might have had an exposure, or all of those questions. And that gets really overwhelming for them, because their job is to be taking care of patients and still having to see those routine people. So if we can kind of help to take that burden off the health system with some of those general questions, that's really great. So we do have the one-call center over in Mahnomen County. Anybody can call that and ask for questions. Mahnomen County residents, tribal enrolled members, that's open to everyone. And that's Monday through Friday, 8 to 4:30. And so they have nurses staffing that for questions. It's also available if people have questions, things like I need help with food or mental health or just other resources. They're able to give resources for those. And over in Norman County, we have seen an increase in calls. Here, we're just utilizing our public health number. People can call. And we have seen an increase. And of course, we get a lot of Facebook messages and texts and people that, have our staff's numbers with just like, what do you think about this? And, it seems like when something is more local, everybody thinks they somehow were exposed to something. And then, our job is really to talk through that with them and what an exposure really looks like. And lots of business communities too. We've been fielding those questions for quite a few days about what to do about employers and that. So,
What can you tell us about the person with COVID-19? Can you release much as far as the male or female age, how they got it? Can you release any of that information, Sarah?
Yeah, we really don't like to do that. So, right away in Minnesota, when there was cases, there was a lot of questions about that, and they would kind of release that information, and they've backed off a little bit on that.
I noticed that.
Yeah, and I think it's just to protect privacy, and especially when you think about in our small rural areas, I think a lot of people hear things anyway, and so when there's less people, the more you release, the easier it is to identify someone, and we definitely don't want to kind of be a part of that. And so I think just going back to that assumption that, it's here, we know it's here, we maybe haven't found it, and so really releasing that information maybe isn't as helpful. I know people are curious and they want to know, and that's just kind of how we are as people, but we really want to respect people's privacy and stay away from that.
And I guess the more important question maybe is, how is the person doing? Maybe you can answer that. Is the person feeling okay? Is it more mild symptoms? I mean, how is the patient doing?
I think okay. There was no hospitalization reported, so yep.
Gotcha. And are you worried about the stigma this creates for people that do get COVID-19? Obviously, being such rural areas, you mentioned, everyone kind of knows each other, and we probably don't want people to think of those that get COVID-19 as the infected or anything negative like that. Are you worried about that at all? And maybe as more people get it, maybe that goes away?
Yeah, I think so. I mean, we've seen that nationally, and in Minnesota has kind of a campaign about viruses don't discriminate, because unfortunately there's been some discrimination against Asian Americans because it came out of China, and calling it things like the Chinese virus, and people. We just want to make sure that people aren't discriminating around that, and so I think about that also locally. With we have. I said I would hate to be the first person that gets it, because everybody's going to know, even if we don't release that information, right? I want to be the 3,000th person, because no one's going to be worried about that then. And so we just really want to remind people of that. Anyone who gets this, especially if you're going to be one of the first cases, people may hear about it. It may go through the community. Just try to think about. Nobody feels good about that, right? Yeah. I mean, and a lot of people didn't know. They're not going to maybe even know. Like Dr. Vetter said, 20% of people are asymptomatic. Well, maybe they could still be, spreading it to some extent. And so we've been saying that all along. People might not know that they have it. And so it's not like we're having necessarily sick people out. And I mean, we've heard weird stories about that across the nation, right? I just heard about some lady who was coughing on a bunch of stuff in a store and she got arrested. I don't think we're going to have to worry about people in Norman and Mahnomen counties doing that. I hope not. But people aren't wanting to spread this. When people know that they have confirmed cases or have been exposed, the experience is that most people just want to stay home. They want to focus on their recovery. They want to inform people that they have had a close contact with, because they want them to know. And so I think, most people they want to take care of it. They don't want anyone else to get sick. And so just think about that. I know I've seen some things on Facebook, and, it's a little bit disheartening to see when people are a little bit critical of things. And so we just want everyone to be thinking about that and think about how you would feel if it was you. You don't want people saying things about you that, that aren't true. So. Gotcha.
And I have another listener question to get to here in a second, but I was going off that. How much misinformation are you guys seeing online? Are you seeing lots of fake news regarding this? People, social media, everything comes out. You never know if it's true. Are you seeing a lot of things that is not true regarding COVID-19?
Yeah, we just had that conversation yesterday about what would this look like if it was the 90s, right? Because we wouldn't have, or any time pre-Facebook, Instagram, Twitter. I mean, I just think it would look very different because the amount of information we would know would be different. People's ability to, comment on everything or share, it would just look very different. And so the way we get our information is so multifaceted right now. When you think about, we watch press releases in the news, and we can Google anything, and we can just see things from around the country. And so, our staff do a pretty good job of that. I think they try to kind of do some surveillance on what people are talking about on social media. And we talk about that in our briefings a little bit too. Like, what are people saying? Are people saying things that are not true? I've seen on Facebook now they have a way to kind of call it out as fake news, whatever the filter is. And so sometimes you see that, which is kind of nice, I think. And so, when we see something that's maybe not true or that people are having a lot of questions about, we think about, like, how can we address that in a population way? Like, what information do we need to share to maybe correct that? And there have been a couple of times, I think, where staff have just had a one-on-one conversation with someone, especially if it's someone they know, and just reiterating, please take your information from the Department of Health, CDC, credible sources, and just be careful about what you hear, see, and read, and spread.
Again, you're listening to the COVID-19 call-in show, and I'm your host, Mark Askelson. Joining me in studio, we have Aaron Stolman with Essential Health and ADA, and Sarah Kjono with Norman Mahnomen Public Health. And if you do have questions, do not be shy. Feel free to get a hold of us here. Call us at 784-2844. Maybe you do have comments on YouTube, or you can comment on the yourliveevent.com link on YouTube. Or again, call us. Don't be shy. 784-2844, or send us an email. And we do have an email question here that I wanted to get to regarding how long does it last, with maybe each case being a little bit different. I know the symptoms come later or start sooner than later, or depending on case by case. How long does it actually do the symptoms last, and then how long before you're cleared?
Sure, that's a great question, and that's a question we're getting a lot lately. So we know that incubation period is 2 to 14 days. So that means that from the day that someone is exposed, we expect to see symptoms within a 2 to 14 day period. The average that we've been seeing symptoms, at least in Minnesota, is around day 5. So that's where I've talked about where somebody could maybe not be really showing symptoms or very mild symptoms and not realize that that's what they have, and so they could be spreading it. There's some really good guidance that comes from the Department of Health, and that's what we look to follow. And this is something that I actually learned this week. So what we've been saying is, if you have respiratory symptoms, you need to stay home for 7 days and 72 hours after you're no longer have a fever without any, fever-reducing medications, and you need to have significant improvement in your respiratory symptoms. And so it's all 3 of those things. We've been telling people that is what you need to do. And then any of those close contacts, especially like household contacts, they need to really stay out of the public as much as they can for 14 days, because again, then they could maybe experience symptoms within that 2 to 14 day period. So that was pretty clear guidance we'd been giving people, because we were saying, there's not a lot of testing. So if you're exhibiting these symptoms, please follow these guidelines. Now that's really hard to tell people, because we're not used to, I've had 2 different staff who, one of them just had a cough, and I'm like, I'm sorry, you got to stay home. And she was kind of not very happy with me. And I had another staff, and of course nurses too were the worst ones. We just go to work and plug along, but we have to be practicing what we preach. And this week I had a couple questions about, well, is that guidance the same for actually a confirmed case? And I thought, well, I haven't really thought about that, because we haven't had that. And so I had a conversation with the Department of Health this week about that. And that is the same guidance they're giving for confirmed cases. So, if you know you have a confirmed case, you're able to manage your symptoms at home. It's that same guidance of 7 days from the onset of symptoms, and 3 days without having a fever, and significant improvement of respiratory symptoms. And so I think this was also an interesting thing, and I think a good thing for people to know. If you are diagnosed with a confirmed case, the Department of Health does do a pretty thorough contact investigation. And so that looks like probably anywhere from an hour to 2 hour phone interview, if you're well enough to do that. Otherwise, they do it with family members. And so when they do that, they work to identify those close contacts, and then they do follow up with those close contacts and ask those people to quarantine for those 14 days from the day of the exposure. Along with that, they do daily check-ins with the confirmed case, asking them about their symptoms. You know, do they still have a fever? How's their cough? It kind of goes through, and so they're doing daily check-ins. So there's some two-way communication about that, and they can also give a little bit of guidance and give them some local resources if they have questions. And kind of the other part of that is if people do get confirmed with a case, but they're able to manage their symptoms at home, but maybe they don't have someone who could drop off groceries on their doorstep, that's when the Department of Health would call local public health to work on those essential needs for people. We're kind of already saying we'll do that for people who are just worried about going out right now, but that is a part of the isolation and quarantine plan through the state and locals, is that then that would trigger them to call us and say, hey, you have a confirmed case here, they need X, Y, and Z, please help them, you know, with what those needs are.
This question here for you, Aaron. Governor Walz, of course, with the stay-at-home executive order, he said part of the reason for doing that was to kind of free up the ICU units and beds and ventilators and those things like that, the respirators, to not burden them all at once. Do we have any ICU beds at Essentia Health in Ada? They said there's 243 only available in the state. You know, how many are available here locally, and do you have the equipment and stuff as far as the ventilators or respirators to handle the cases?
We do not have an ICU bed here in Norman County, nor do we have ventilators. So those patients would need to be transferred to a facility that does. And those are things that hospitals are working together on to coordinate, both within our own health system, Essentia Health, but also as coalitions, as a broader group of hospital partners to talk about how do we manage this as healthcare partners as a whole.
Gotcha. And I know also they're looking into external facilities such as arenas, factories, or whatever, to turn into a potential intensive care units or just additional like hospitals. Have you looked at anything like that locally that could be used? I know we have a couple old schools and things like that. And have we started looking into facilities locally that could be used as hospitals?
I can just say I know across the state that they're looking at those options. I think it was earlier this week, they talked about Appleton, I believe it was. That was an old jail facility, and they had kept that kind of in licensed shape, so it was well enough to maybe look at turning into a hospital unit to help with that. I know each kind of healthcare coalition region is working on that as a larger region, about where could they identify another maybe site to stand up additional hospital beds or the like. So maybe that isn't quite county by county, but more of a regional effort at looking at those options.
Gotcha. And were you surprised by the executive order by Governor Walz? It kind of seemed like everyone in the area was doing a good job at staying at home, or in the state even doing a good job of doing that. And then on Wednesday came out with the executive order that we're going to be staying at home pretty much for non-essential trips and things like that. Were you kind of surprised that came out?
You know, I had a few people over the weekend say, I bet that's coming on Monday. You know,
Yeah.
so there was people that were like waiting for it on Monday, and then it didn't happen on Monday, and it was like, okay, well, and it didn't happen on Tuesday, and we do feel like a lot of people have been really, you know, taking it seriously and doing a good job. And I don't think it was a decision that was made lightly. I think it was, you know, very thought out. I think the governor was very intentional about doing research with the U of M and doing some modeling and looking at, you know, what does this look like and how much time will it actually maybe buy us? You know, something he said on Wednesday that kind of made me just go, oh, when he said, you know, it's too late to flatten the curve. Now we need to worry about allowing our healthcare partners enough time to ramp up for that apex or that peak when it does come. And so if we can push that out, you know, from 63 days, which I think is what he said, if we would have done nothing in the state of Minnesota and just let this, you know, run its course, he was expecting to see that apex a lot faster. And so by putting these community mitigation and the stay-at-home orders and doing all of these things, we're hoping we can push out that apex quite a bit further so we can have more time to just be prepared and kind of ramp up some more beds. We can get more PPE, and we can feel like our healthcare partners are really supported and feeling good about where they are at to be able to take care of these patients.
Yeah, the whole flatten the curve thing kind of got demolished. I think that was the big goal: flatten the curve, flatten the curve. Do we kind of throw that theory out the window for future pandemics? I mean, did it not work as well as we thought it would?
I think, I don't think we throw it out the window. I think that's a huge part of pandemic planning. I think what I've heard is that we didn't have the effective testing to be able to do the surveillance to flatten the curve. So it kind of like, because we couldn't be testing, that made it a lot more difficult to know kind of where to put those interventions into place and what to do. And so I think really it was hard without effective testing early to be able to flatten that curve.
What do we look like in your mind a week from now or 2 weeks from now? We're expected. Is it going to get worse? Will it still be a couple here and there every day, or the cases actually seem there's not really a trend. One day it's 20 new ones, one day it's 60 new ones, and I think today 30 or 40. I don't remember what it was. What do we look like 2 weeks from now?
I've said this before.
You never know.
That's the $1 million question. I think we'd all love to know that. I agree. I think we've expected to see more of a trend with the testing numbers. The Department of Health is really, on their situation update page, they have a really nice page where they have a map of where the cases are and how many per county. And then towards the bottom now they have kind of a curve, and then they show the number of positives and following that trend line. And yeah, you look at it and it's like up and then it's down and then it's up and then it's down, and you kind of would maybe expect it to maybe go up a little more. I think a lot of that's just because of the testing capabilities and availability and just kind of how part of that works as well. So, I think, yes, we do expect to see more cases. We definitely expect to see confirmed cases here in Norman County and throughout our region. And we do expect to see it go up. We're very intently watching what's happening in other states where this is hit earlier. Kind of day zero for us, I believe, was March 6th. That was the day of the first case identified in Minnesota. And so I think that puts us 3 weeks out today from that date. And so, it's really important that we're learning from other countries and other states who, if you look at New York and some of these other states that have been fighting it a lot harder, and they're right in the thick of it right now, we can kind of learn from them and see, and hopefully people will take it seriously, and we can help to just slow the spread and prevent some of the things that are happening other places. I think it's been pretty clear that it's expected that maybe somewhere from 50 to 70% of the people are eventually going to get this, right? Because we're not going to have that immunity, and we know we're not going to have a vaccine for quite a long time. And so we still just need to be prepared and kind of be thinking about that. This isn't just going to be over in a couple weeks or a month, or, but we also are going to have to figure out a way to kind of deal with it, if you want to say. We need to figure out how to keep some of our operations going, and how we're going to just adapt and maybe do things a little bit differently, really for the purpose of protecting those most vulnerable in our communities.
Gotcha. Again, if people have questions, don't be afraid to call. I like to think that I'm asking good questions, but I know there's ones that I'm not covering, so don't be afraid to call us 784-2844, 784-2844 if you have questions here for our health experts here. With the stay-at-home executive order, will public health be assisting in enforcing that at all? What's your kind of role in that? I know, the law enforcement, they have more increased presence right now, mostly because they've mobilized to be socially distant, but they can't just go and pull people over asking where they're going and why they're on the roads and things like that. Do you guys have a role in that executive order in enforcing that at all, or?
Yeah, locally, we don't like to be the enforcer public health agency. We talk about that a lot, even with the hospital. MDH is usually seen as like the licensor and the enforcer of the rules. And local public health, we like to be the kumbaya collaborative partner. We don't want to be telling people yes or no, you can't do this. And so, it's kind of an interesting role. But we have had some conversations about that, being a public health emergency. I don't think the governor's intent was to be, people out arresting people, or it's not going to be martial law. That is some misinformation I've maybe seen on Facebook. I've seen people saying, oh, you're going to have papers if you're driving to work, or you're going to have your name badge because you might get stopped. And that is not what this is going to look like here in Minnesota. It's really going to be an honor system. We want people to stay home if they should. If you're not an essential business, we understand that is very difficult. To think that you're going to be out of work for 2 weeks, but this is a big ask, but it's really to support our communities, and it's really the best thing that we can do right now.
All right. Are you afraid that us as Minnesotans, specifically small town Norwegians, we have a lot of pride and we don't like to stay home. We got work to do. We got fields to work, all that stuff. Are you afraid that people won't be staying home or haven't been staying home because they've been sick or even had mild symptoms that they're working through it and getting other people's infected? Is that a concern that you might have? Just because we're very prideful, we don't want to stay home. We got work to do. Are you afraid of that?
Um, to a certain extent, yes, I think, we have heard about maybe people aren't taking it as serious and still having gatherings. And I know as a parent, it's hard because your kids are frustrated. They don't just want to be at home. And then kids are going to childcare at the school if they're an essential worker. And so some people aren't understanding why that is still happening and why you can't then go and, go to your friends or get a bunch of kids together on the weekends. And those are hard things for us all as adults as well. And so, it's not just if you're sick that you shouldn't, or having any kind of symptoms. Even if you're feeling healthy, now with the stay-at-home order, it's not about just I'm going to go to my neighbors and hang out for the weekend. You really need to be staying home and not having those interactions, and that's pretty clear. I mean, it's kind of the essential workers, and then it's if you are responsible to take care of someone, or deliver something, or you have a elderly parent or a child. Yes, of course, you still need to do those things, but in this 2-week time period, it's really not the time to have a get together in your shop or have your kids have a huge play date or, invite a bunch of high school kids over for a movie. Like those are the exact things we need to not be doing right now. And we do need people to take that serious.
Maybe Aaron, you might know this question. How are the seniors at the Benedict Living Community and other facilities? How are they handling all this? They're really cooped up and they're not able to get out and explore and have a lot more limited contact with their family and things like that. They're used to those regular visits and just that normalcy. That's kind of out the window right now. How are they handling all this?
In conversation with the leadership in both of our nursing homes in the county, Angie Nelson and her group over in Halstead, and Jean Ann Bennick here in Ada and her group, they are trying to be as creative as they can to keep those folks in contact with their friends and their family and keep them engaged in different activities and different things to of course keep their spirits up and keep them engaged in the goings on. So they've done a wonderful job and they continue to work on it, and it's hard for all of us. It's certainly hard for them as well. But I think those two places and the staff and the people there take it very seriously, and they're doing a great job.
On the flip side, how are the youth handling this? I know, Sarah, you have young kids. How are the youth, the younger kids, handling all of this?
I think it varies. I think it's harder for maybe some of the kids in grades that had like something special happening in the spring. I think all kids like school a lot better in the spring because that's when all the fun stuff happens. And especially for our seniors, that's incredibly hard. And, they're missing all the fun stuff, whether it's musicals and tournaments and their last season of softball, baseball, track, prom now. I know at our school we're like, okay, well, that was supposed to be before the May 4th. Deadline. And so, there's a lot of, I think, anxiety about that and what this is going to look like. And, I had my niece last night said, what am I going to get my diploma in the mail? Or I don't even know, and so, yeah, I think it is really hard for them. I do think, though, they're a lot more technologically advanced than us. And so I think we're all learning something from them. I know that's really a great thing. About the kids, I have a 8-year-old who really doesn't have a cell phone or anything, of course, but, it was like, Mom, can I get this Messenger Kids? Because my friend maybe has. So now she can, at least have a little bit of video time with her friends. And so that's been really, really helpful. And so I know a lot of families are taking advantage of, Facebook Messenger calling or Zoom. Zoom is a free app that families can use. And so we talked about doing that next week with a larger group of my family just because, we can't see each other. And so it gets you get kind of like, okay, I'm stuck in the house, I'm seeing the same people. So whether it's kids and adults, or if you have grandparents and you can talk them through it on the phone, how to set that up. Usually things are pretty easy. You can just send them an invite and they just have to click on something. But I think we're all going to come out of this maybe a little bit more technologically skilled, that'll be a good thing, you know. I think maybe it'll help us connect a little more often because we realize the importance of that. You know, something I saw the other day was we keep saying, you know, practice social distancing, but really let's practice physical distancing. And when you think about it like that, it's like, oh, yeah, really, we named that wrong, you know, because we don't want people to socially isolate and socially distance. We really want them to do the physical distancing, but still stay socially connected. So when I heard that, I thought, oh, that's a really good point.
What other effects do you anticipate coming out of this this next probably 2 weeks to a month of social distancing or physical distancing, I guess, and people kind of being isolated to their homes a little bit? What other effects do you see coming from this, whether it be like I said, an increase in crime, or, you know, people, mental health is one that maybe comes to mind. I mean, what other effects or consequences, whether it's health or law enforcement related, what effects do you see coming of this, of everyone kind of being isolated in their homes, not entirely, but mostly here for the next couple weeks to a month? What could or what might happen out of this?
Yeah, I mean, we've definitely had conversations about that, you know, both locally and in different groups. And, you know, yeah, just because we're all isolated to our homes doesn't mean, you know, law enforcement won't have anything to do, right? Yeah. Or, you know, we hope they don't. But we definitely, we just had a discussion yesterday internally about mental health, and the mental health center I know is doing some things, and locally different providers are thinking about how can we still provide services, and schools are providing resources around that. And I know all of our school counselors and social workers are available for families and for kids if they still need to have that connection, because a lot of our youth especially, I think, rely on that during the school day. And so it's hard to think that they maybe won't have that face-to-face connection with that trusted adult. So we may need to get a little creative and do some more frequent check-ins with people. We've also talked about, you know, we have a mental well-being kind of coalition that we work on, and so that's kind of, now that we're, you know, kind of feeling a little settled in this COVID routine as an agency, you know, we're like, okay, maybe we can think of some creative ideas for mental well-being, and how can we connect in with people. And we got some ideas yesterday from a couple of counties out of the metro area, actually, that are, you know, scheduling some Zoom check-ins, and anyone from the community, if you want to come and just have a chat, or, you know, just some different ideas. And so we're just trying to kind of think out of the box on that, and how we can help to support people and feel like they still have a place to call or connect with, or whatever that looks like. And so I think if community members have ideas about that too, we're sure open to that. And we really just want to make sure people are doing those things like Dr. Vetter had said as well, you know, getting enough rest, exercise, all of those things that are good for our body. You know, get out and enjoy the fresh air. We're going to have some 50-degree weather here soon, so people can still go for a walk, and you can still play in your yard, and all of those things, and those are really important for your mental health as well.
Gotcha. All right. Hey, maybe we see less, you know, some other things. Look, people talk about environmental impacts it could have, you know, less pollution because there's less cars, less car accidents with less car on the road. So, I mean, you know, maybe in the emergency room, Aaron, you might see less people coming in for things they probably wouldn't, you know, normally be out and about a lot more. Probably aren't. They're probably inside watching TV more. So maybe you see less people in the emergency room. You never know.
Absolutely. Honestly, I think we already are seeing less people in the ER, which is a good thing. You know, the ER really is a place for people who are having that emergent and need that emergent care. And we already are seeing less people. So that's, like you said, probably a good outcome.
Gotcha. All right. What other questions and are you guys getting at public health right now, Sarah, as far as related to COVID-19? Are there other questions and things that you guys are fielding a lot of concerns about at this time?
Yeah, I think recently, we did put out the end of last week about volunteers. And so I've mentioned that a few times. If we've had some people, actually quite a few people call and offering to volunteer, which is wonderful. We're talking a lot about the negativity and things around this COVID-19 pandemic, but, it really does bring the best out of a lot of people too, and our communities really do come together. And so we've had a lot of people offering their services. We've had some people call and, requesting services, groceries, whatever it is. And so that's what we really want. We want people to reach out because we have volunteers that are ready to help. So we have been getting more questions about that, which is great. And so we encourage people to call if they, have any types of those questions. We also get some questions just generally around I can't work and I'm concerned about even having money for groceries, and so we know about a lot of those resources. We can talk to people, a little bit about the unemployment thing, and we know where to direct them because it's pretty clear to go to the website. We have local resources like the Salvation Army who's willing to help out for people. And so if people are having those questions or concerns, just to know they have a place to call to talk about them, and we can sure brainstorm those things. That's what we're there for. So I think that along with yesterday, I know you saw and ran a news story too about the PPE, the personal protective equipment donations. And so something that we're definitely, the county is partnering with Essentia Health on, and the goal is really to have those donations for local responders within the county. So whether that's EMS, fire, our nursing homes, medical personnel, whatever that looks like, so we can help to make sure our local people are taken care of, and those people that are ready to support our communities are being supported and feeling like they have the proper equipment to do that.
Speaking of local first responders, have you worked with our area fire departments? I know those are often the first responders in a lot of our communities. Maybe there's an ambulance or a volunteer ambulance service as well. Have you been working with our local firefighters and maybe police departments to provide them the training they need to handle a patient that may have a COVID-19?
I can just speak a little bit from public health. We fielded some of those questions. I know some local fire departments have met and talked about that. Same with, police department and sheriff's department. We've worked in both counties with our, along with White Earth too, about providing some fit testing. I know Essentia Health is doing that as well. And that's really to make sure people have the correct N95 mask and the correct fit for that. And so, we're fielding some of those questions. We're available to do that along with Essentia Health, and we definitely can help those groups out if they need it. That's really what it's there for. We want to make sure they feel prepared to be able to take care of those people because, like you said, they are often the first ones on the scene. So,
and just a few more questions here. When should people be concerned that they may have the COVID-19 virus? At what point do they realize this isn't the regular flu? I need to get a hold of someone or contact, a hospital or whatever. At what point of their symptoms should they be reaching out to the hospital?
So I guess I would probably echo a little bit of what Dr. Vetter had said earlier about if you're at home and able to manage your symptoms at home, stay home, manage your symptoms. That acute respiratory distress is really where people end up needing to be seen, needing to potentially be hospitalized. That's the point where increased services are going to be needed, is that respiratory distress. But if you're at home and you can manage your fever with over-the-counter medications and manage yourself like you would with any other viral infection, we encourage you to stay home.
All right. Well, what else do we want to cover here on our time on our COVID-19 call-in show? I was really hoping for more call-ins, and we still will field questions if people have questions. 784-2844. We did have a bunch via email, but what are the things we want to make sure that people know while we got some time here on air?
Yeah, I thought we'd get some more questions too.
Right?
Right?
You get people calling you all the time, I'm sure. Why not us?
Well, no, and I also feel like, maybe it makes me feel okay that we aren't getting a ton, and maybe we've been doing an okay job of sharing information as well. So, I don't really know that I have anything else that we haven't talked about today anyway. But, we just want to still share the message about, the importance of the physical distancing or social distancing, people continuing to wash their hands, stay home, enjoy your time at home, and really, take this seriously, because it really, all of these measures, you may feel like they might be a little ridiculous, or well, I'm not that worried about me, but it's really about the people who we all need to worry about. And it's about those most vulnerable, and that's who you're protecting by staying home. It isn't all about just you, it's about the community as a whole. And so the more people can understand that, I think the easier it makes it for people to kind of suck it up and stay home and, and do what you're being asked to do. Obviously, if people need to be going out, I see some of our grocery stores and other places maybe changing some hours and making things a little differently, and encouraging maybe only one person per family to be coming in. I think that's great advice. The more, we don't need to bring our whole family of 5 into the grocery store probably if we don't have to. And so if you can maybe just have one person go in, get your groceries, be respectful at the checkout, stand your 6 feet back, just any of those things we can do, and just to keep everyone safe, especially the people in the essential positions. They don't really have a choice. Our grocery store workers can't say, well, I just want to take a 2-week vacation right now. That's not really working for them. So you're doing it for those who are most vulnerable, and for your essential workers who are really there supporting you and making sure you have what you need. So please stay home for them.
And use a debit card or a credit card, so you don't have to hand cash out. I thought about that the other day, like when I was handing someone cash. I'm like, oh, I don't want to be spreading my germs to them, whether I had COVID or not. I mean,
Right.
just in general, and then they give me change that someone else touched. And we always talk about money being the dirtiest
Yeah.
thing out there.
Yeah.
Maybe use that credit card instead. It might not be a bad idea. Sarah, Aaron, I really appreciate you guys taking some time to be a part of this program and join us on a regular basis. We'll probably continue to get updates here next week as we move forward, and maybe as things progress. We hope not. We hope not to have anything locally in Norman County. We don't want to see it continue to spread, but it's likely a scenario. So we'll continue to have you guys in here and provide updates. But appreciate you guys coming in here today and sharing this information. Stay safe, stay healthy, and we'll talk to you again here soon.
Thank you, Mark. You as well.
Thank you, Mark. I would like to add one more thing if I could.
Absolutely.
We are in partnership with Public Health. We are accepting donations of any masks or gloves or gowns if people happen to have that at home. But I think the masks are probably the big one with our ag community. If you have masks on the farm at a manufacturing site, and you are willing to part with those, we are accepting donations. The west entrance to the hospital campus, there's a sign up there that kind of directs you back to a back garage area that we have that we're collecting those donations. And that booth is open until 7 o'clock tonight. And if in the future you want to donate, we ask that you call out to the hospital at 784-5253.
Awesome. All right. Yes, good reminder there. Thanks for joining us, you guys. We'll talk to you again here probably sometime next week, I imagine.
Thank you.
All right. Again, that was Aaron Stolman, Administrator of Essential Health in Ada, as well as Sarah Kjono, Director of Public Health. And also earlier today, we chatted with Dr. Rich Vetter, the Chief Medical Officer at Essential Health in Ada. You've been listening to the COVID-19 call-in show here on KRJB, KRJM, and online at yourliveevent.com.
You've been listening to the COVID-19 call-in show with R&J Broadcasting Incorporated on KRJB 106.5 FM, KRJM Gold 101.5 FM, rjbroadcasting.com, and with a live video web stream on yourliveevent.com, which is powered by R&J Broadcasting Incorporated and Holstead Telephone Company. If you'd like to listen back to the program, we'll have it archived at rjbroadcasting.com soon and on yourliveevent.com.